Many thanks for joining us. I am Ansmane Sonyasi, and this is Qtv News coming to you live from our studios along Keraba Avenue. Coming up this evening, as the blessed month of Ramadan starts, we speak to a nutritionist and an Islamic scholar about healthy eating during a month of fasting. According to a recently released survey, a majority of Gambians believe prayer is more effective than vaccines against COVID-19. The SGBV unit at the Ministry of Justice has held a seminar to understand the problems and find solutions and effective ways to collaborate in helping survivors of sexual and gender-based violence. In international news, President George Weah of Liberia has appealed to the community parliamentarians of the ECOWAS Parliament to adopt resolutions to advance the cause of women's empowerment. And 20 school children have been killed in a fire at a school in Niamey, the capital of Niger. Well, for more on these and other stories coming up, do stay tuned. And now we take a look at the news in detail. Now, although fasting can be challenging and sometimes uncomfortable, the mental and physical benefits are enormous, according to experts. As Muslims around the world observe Ramadan, we spoke to a nutritionist and an Islamic scholar about the significance of good and healthy eating during Ramadan. Ajibintu Drame has more.
This is the holy month of Ramadan. During this period, people's eating habits change. Some tend to eat more than usual, which can be uncomfortable and unhealthy. A nutritionist and nutrition program officer at the National Nutrition Agency, Hadi Crooks-Low, explains the significance of having healthy meals after fasting.
Our staples are whole grain. They are rich in fiber, and they are not totally polished or refined. And if you can see in our Gambian context, what we love most is rice. But this is not only what makes part of the staple food groups. We have millet, you have findi, locally called, you have corn and the like. So how can we think eating differently from just rice during Ramadan?
Hadi Crooks further explains what to do to avoid harmful health issues.
We tend to eat too much oily stuff, and especially in the period of Ramadan, it's not important because looking at the time at which we eat, you cannot eat something that's really greasy at night. And the fact that you're eating carbohydrates too, already your body has a source of fuel. So it is important that we look at our method of cooking. We should prioritize more of steaming. We should prioritize more of grilling. We should prioritize more of stewing, in the sense not the stew we commonly know.
Sheikh Essa Fode Dabo, the president of the Gambia Supreme Islamic Council, had this to say.
The teaching of Islam, the Almighty Allah said, Kulu washrabu wala tusrifu. Eat and drink, but limit yourself. Do not exaggerate. Do not go beyond what you can eat. So this is very, very important for somebody to limit and then take what you need and then leave what you don't need. Exactly. So it's not allowed for somebody to eat after eating. You cannot even, perform your prayers.
Implementing good eating habits is quite important during this period as people eat at specific times. Having not eaten throughout the day, it is important for people to know the type of food to take, notwithstanding those with a history of medical complications. Hadi Crooks further explains.
We know of our traditional porridge also, rui, that is enriched with cream, or the normal sow, that is the fermented yogurt, traditionally fermented yogurt, are all ways in which we can enrich this local product, this local meal that's called rui, that's made from millet or koos. So as a start for the fasting, these are good options. Eating wisely, knowing that we should add variety, but also diversifying our meals is important. And one thing also I want to mention is hydration. Most people forget this. We should drink as much as possible because we are approaching, it is already hot nowadays. And people tend to go and do their various activities under the sun. So make sure you hydrate. It's important. Most of the times, from what the complaints you usually get, maybe you'll get this more at the health facility. But we know in terms of nutrition-wise that people come out with problems like indigestion. They complain of heartburn and the like. And it is all due to overloading the stomach or not eating what is appropriate. Like I said earlier, we should be gentle. It is true, Ramadan is associated with being elaborate, with sharing and all, but there is nutrition, or there's nutrient in just being, modest in your eating.
Hadi Crooks urges and emphasized that people should change their ways of eating, even outside of the Ramadan, and adopt a healthy lifestyle to avoid health complications. Ajibintu Drame, QTV News.
Interesting report there by Ajibintu Drame, and a message for my full and serious people: do not overload yourselves. Now, the Afrobarometer, a research institute, on Wednesday released its public survey data on the perceptions of Gambians on COVID-19 and the government's response to the pandemic. Alusise reports.
This is the 8th public survey conducted between January and February this year by Afrobarometer in the Gambia. According to the survey, 7 in 10 citizens, 69%, say prayer is more effective than a vaccine will be in preventing COVID-19 infection. The survey reveals that 2 in 100, 2%, say they or a member of their family became ill with COVID-19, and 4 in 10, 42%, say they lost income because of the pandemic. The findings added that 8 in 10, 79%, say they or their households received government assistance during the pandemic. But a slight majority, 53%, believe the benefits of government programs to support people during the pandemic were not fairly distributed. Only 2 in 10, 21%, say they are likely to try to get vaccinated, according to the Afrobarometer survey. On the lockdown restrictions, a majority, 61%, say the enforcement of the lockdown was too strict, while only 2 in 10, 22%, anticipate that the pandemic will be somewhat serious or very serious in the Gambia in the next 6 months. Seth Matijau is the national investigator of Afrobarometer.
About 7 in 10 citizens, 69%, say prayer is more effective than a vaccine would be in preventing COVID-19 infection, including 52% who think prayer is much more effective than the vaccine.
In a panel discussion chaired by journalist Fatou Kamara, Dr. Mustafa Bitey, Director of Health Services, and Alassane Senghor, Secretary General of the Gambia Red Cross Society, welcomed the findings of the Afrobarometer. They believe such public opinion surveys are relevant for policymakers and Gambians in order to effectively understand the needs and aspirations of the people.
You could see that in the findings, only 20% actually are ready to be vaccinated, for example. That is very low. And it's reality we are living. Right now, we have a COVAX facility that is to provide 20% of the country vaccine. At the first shipment, totally what we have is about 51,000. That's so small, like less than 2% of the book. And it's difficult for it to get. We were thinking just within 1 week we will finish that vaccine. And it's now 5 weeks, 6 weeks or so. We've not finished that vaccine still.
Everybody knew what COVID was. I think what was missing, there were 2 things. One is at operational level and the other is at strategic level. At operational level, what they call RCCE, this is risk communication and community engagement. There was much more emphasis on risk communication than on community engagement.
A national partner in each country conducts the survey. In the Gambia, this latest survey is conducted by the Center for Policy, Research and Strategic Studies, CEPRAS. Afrobarometer is a pan-African, non-partisan survey research institute that measures citizens' attitude on democracy and governance, the economy, corruption, social tolerance, and other topics making headlines. In 1999, Afrobarometer was launched in 12 countries and is currently in over 34 African countries. Its surveys are carried out using scientific survey methods such as face-to-face interviews. The Afrobarometer's findings have been a major source by reputable institutions, including the Abraham Index of African Governance, World Bank, and the UNDP, for indicators towards the prospect of attaining the Sustainable Development Goals. The event was attended by National Assembly members, civil society organizations, the British High Commissioner, and representatives of the EU. Reporting for QTV News, I am Aliou Cisse.
The Sexual and Gender-Based Violence Unit of the Ministry of Justice on Tuesday convened a day stakeholder seminar to better understand the problems and find solutions and effective ways to collaborate in helping survivors of SGBV. Aliou Cisse again.
Sexual and other forms of gender-based violence are increasingly reported in situations of complex emergencies such as the coronavirus pandemic. The term sexual and other forms of gender-based violence comprises not only rape and attempted rape, but also sexual abuse, sexual exploitation, forced early marriage, domestic violence, marital rape, trafficking, and female genital mutilation. Dawda A. Jallow, Attorney General and Minister of Justice, describes gender-based violence as a societal menace imposing so much injustice on women who are the most affected.
Recently, we have seen a surge in online violence directed at women. These acts involve cyberbullying and harassment of women in online space with threats and other forms of intimidation. The consequences of sexual and gender-based violence can be severe. It leads to physical harm, sexual harm, emotional and psychological harm, health problems, and lasting trauma, and in some cases, death.
Ella Rosalyn Dugan, chairperson of the SGBV unit, said her unit has been spearheading community outreaches and media campaigns to raise public awareness on the prevalent cases of GBV, which are not talked about openly.
The Sexual and Gender-Based Violence Unit of the Ministry of Justice was established as part of the Transitional Justice. The unit is made up of state council prosecutors, police prosecutors, social welfare workers, who together work in order to protect and seek justice for the victims of SGBV in the Gambia.
Ibrahim Abba, Assistant Deputy Inspector General of Police, and Jankoba Jabi, Director of Social Welfare, both expressed their institution's commitment to the fight against SGBV in the country. They advocate for more collaboration among stakeholders to bring offenders to justice.
The Gambia Police Force will continue to count on your partnership, collaboration, and support at this critical stage to end the scourge of violence against women and girls in the Gambia.
Sexual and gender-based violence have been and continue to be a concern not only to the Directorate of Social Welfare, but at national, regional, and international concerns.
David Belgrove, the British High Commissioner to the Gambia, whose office funded the seminar, said no woman should live in fear of violence, as he observed SGBV as prevalent in almost all countries. He called for a holistic approach against the menace.
SGBV crimes, they're not cultural. They affect everybody and every country, but they are criminal. And that's why I was pleased to hear the words that we're coming for you, we're coming for the perpetrators, because people do have to understand that they cannot commit these crimes with impunity and that there will be justice.
Studies on gender-based violence have shown most of the victims and survivors are women, while most of the perpetrators are men. However, there are also reports of men who suffer gender-based violence. The SGBV unit also intends to organize a national conference of all stakeholders, such as traditional and community leaders, to continue the discourse on how to combat SGBV in the society. The event witnessed the handing of desktop computers and printers to the SGBV units of the Ministry of Justice and the Police. Reporting for QTV News, I am Aliou Cisse.
And that report by Aliou Cisse will lead us to the commercial break. We will be back in a moment. Thanks for staying with us. Now, more than anything else, COVID-19 has shown us that improving our health sector should be a priority for all. Save Our World, a Gambian-based charity, on Tuesday donated medical items to the Edward Francis Small Teaching Hospital in Banjul. Abibatu Cisse tells us more.
The items include 22 hospital beds, boxes of drug, wheelchairs, bedside stools, chairs and crutches, amongst other valuables. Presenting the items, the chairperson of Save Our World charity, Abdou Diallo, urges Gambians to take up similar initiatives to address healthcare challenges in our country.
I think once we have what we need here at the Edward Francis Small Teaching Hospital, there may not be any need in the future to have patients travel all the way to Dakar or to other countries for treatment. Our belief and our hope is that if we continue doing this, in the future, the hospital will be fully equipped and will have the standard necessary to treat all kind of patients. And we hope this we hold as a belief that it is possible in the future.
Receiving the items, the PRO of Edward Francis Small Teaching Hospital, Jalimorin Jai, says health is everyone's business and commends Save Our World charity for supporting the hospital.
I'm a regular donor to the hospital. So this time around, they brought hospital beds and some medicines, valuable ones, which will go a long way in helping to administer the needed health care. Our brothers and sisters who are admitted here do need. I mean, some of these drugs are very expensive, and if you want an individual to buy it outside, it costs them a lot of money.
Morikeba Danso, a doctor at the hospital, says the items are of high quality and will go a long way towards supporting the health sector.
Very great job, because next minute the person who will be admitted and benefit from those material, nobody knows who those people will be. It could be me, it could be my relative, it could be somebody else's relative. So this is a very, very good gesture. I think it should be emulated by every good citizen and everybody residing in the Gambia and elsewhere to help.
Lamin Diallo, Save Our World's treasurer, made this appeal to the hospital management.
The medications is for free, and we just appeal that they be given free to the patients needed. The patients needing these materials to be given to them.
Save Our World charity has been involved in building mosques, drilling boreholes, and supporting widows. The organization provides assistance in collaboration with their partners in the United Kingdom. Abibatu Sise for QTV News.
Action Aid the Gambia, with support from partners, are implementing a 3-year project to engage civil society organizations to mobilize citizens' actions towards green economy and environment sustainability. Babu Karsi reports.
The training seeks to enhance understanding of civil society, community-based organizations and relevant government ministries on climate change and environmental sustainability, governance and accountability. The €500,000 project will run for 3 years with a special focus on climate adaptation, sustainable environment policies, governance and accountability. At the event, the executive director of Action Aid the Gambia, Omar Baji, said climate change is affecting the world and the Gambia is no exception.
There has been an average decline in rainfall amount over the past 30 years in the Gambia of about 30%, with variations in distribution across the regions. Furthermore, it has been estimated that only about 6% of the arable land in the Gambia is under irrigation, with 94% of production totally dependent on rainfall. This makes the country quite vulnerable in terms of food production and availability. With climate change, the situation has become worse. The impact of climate change affects a large proportion of Gambians, given that about 70% of the population is engaged in agriculture for a livelihood.
Ismaila Jaju, coordinator at United Purpose for Gambia, Senegal and Guinea-Bissau, said that training stakeholders about climate change is one of the pillars of the project.
The climate is changing because of man's action in the planet, which has a huge range of activities that we are doing. In our part of the world, we look at wanton destruction of the forest cover. It's rampant and it's pervasive and it's ongoing. And also know that that has an impact on the soil. How do we manage our soils in the light of climate change? How do we manage our soils in our pursuit of our livelihood? That is farming. Is the main livelihood of the bulk of the people in this country. And they need the soil, they need the forestry, and they need rain. In order to do that better, you have to understand how do you go about climate-smart agriculture.
Mala Jallo, a participant from Madembakunda in Upper Nyomi, said climate change in most cases is the cause of our actions and the training will help in tackling the problem.
Wecci jaww ji lu bari ci Yàlla la waaye lu ci bari ci ñun la te léegi suñ garab yi maamaati maam garab yu fa nekkoon yëpp daanu na.
Climate change is caused by our own selfish interest and lack of knowledge. People continue to cut down our trees, causing deforestation, and nothing is done about this. For me, the authorities should apply strict measures, and anyone caught illegally cutting down our trees should be prosecuted. That is the only way we can send a signal to the rest. In my farm, I have rosewood trees growing there, and I'll make sure they are preserved even though I saw illegal cutting of trees nearby.
The Gambia has recently witnessed low amounts of rainfall with 6% of arable land under irrigation. The climate situation has become worse, affecting a large number of the population, 75% of whom depend on agriculture and rainfall. Action Aid is an international organization that has been working in the Gambia since 1979, focusing on the rights, needs of the poorest people in the areas of health, education, clean water, and ensuring a decent living. Babu Karsi, QTV News.
The Mauritanian community in the Gambia on Monday inaugurated its new office in Banjul, which aims to promote and address their needs and concerns. Ajibindu Drame tells us more.
The event was attended by some ECOWAS dignitaries as a sign of solidarity and support for the Mauritanian community in the country. This is the first time the Mauritanians have established an office where they can meet and discuss important issues affecting them and find ways to address them. There are an estimated 6,500 Mauritanians living in the Gambia.
I want to thank everybody. This Mauritania community is in the Gambia. It's not today. Including the relationship between the Gambia and Mauritania. This office for the Mauritania community in the Gambia, because every community, for every country, you need to make it organization to planning of everything to get good relationship between him and this country, and get good relationship between the population and the Mauritania and the population of the Gambia and the government of the Mauritania and the government for the Mauritania.
The bilateral ties between the Gambia and Mauritania date back to our previous governments with the exchanges of diplomatic missions and trade relations, such as the signing of an MOU on fisheries, amongst others. Ahmed El Mali Minan added that the opening of this office will further strengthen bilateral relations between the two countries.
My plan is to include in the Mauritania and the Gambia, the relationship between Mauritania and the Gambia, because that one is very important. Not today, it's long time. Mauritania and Gambia is have good relationship. The President Adama Barrow, His Excellency Adama Barrow, and His Excellency Mohamed Al Ghazwani is for group parliamentary from friends Mauritania and Gambia. That one is diplomatic people. That one is add many things for Mauritania and Gambia.
Michel Pokpai Koivogi, the president of the ECOWAS citizens in the Gambia, says this structure is significant for not only the Mauritanian community, but ECOWAS citizens as well.
The Mauritanian community has been existing for long, but the time they have organized themselves better to have an office whereby they can meet and discuss their issues. They can invite any authority to discuss very important issues.
Michel Koivogi urges more cordial relations and the promotion of peace and security among the ECOWAS member states.
Our motto even is ECOWAS, we are one, we are one, we are one. Yeah, the message is the same. I want us to be united. I want us to abide by the laws of the country. Is very, very important.
Mauritanians are well known for their business operations that contribute significantly to the Gambia's economy. Other speakers include Qtv Ahmed Karin Ziad, Vice President of the Mauritanian Community Council, who expressed gratitude to the Gambia government for its commitment to protect and respect all citizens and non-citizens living in the country. Ajibintu Drame, QTV News.
Now, a 3-year-old girl is suffering from difficulty in breathing and coughing. and is in urgent need of overseas medical treatment. William Kamara has more.
A cardiovascular examination at the Medical Research Council in the Gambia shows our son is suffering from a history of fast breathing from birth. The report recommends that she requires cardiac surgery, which is not currently available in the Gambia. Kutambalo, the mother, explains her daughter's condition. The sickness started from birth. We didn't know it at the time. We have tried various hospitals, but to no avail. Then we took her to MRC, and they detected that she has a heart problem. Her mother is soliciting for support because the condition cannot be treated in the Gambia. I am seeking for support for God's sake. If anyone can help, because we have no money to take her for overseas treatment. Modu Sen, the child's father, points out that the cost of medication is becoming hard for the family.
The treatment is not easy. It is difficult if you are not strong financially. I am appealing to philanthropists and individuals to help us get our daughter treated.
If anyone would like to assist, please contact QTV to help our son. Please write to news@qtv.gm. For QTV News, Lolly M. Kamara.
Over now to international news. President George Weah of Liberia on Tuesday appealed to the community parliamentarians of the ECOWAS Parliament to adopt resolutions that will advance the cause of women's empowerment in the West Africa sub-region. He made the appeal as he opened a delocalized ECOWAS meeting in Monrovia. Alucise reports.
The Liberian President George Weah made this call in Monrovia on Tuesday during the opening ceremony of the ECOWAS first delocalized meeting of the Joint Committee on Social Affairs, Gender and Women Empowerment, Education, Science and Culture, Health on the theme Empowerment of Women in the ECOWAS region. The theme of the meeting is something President George Weah said is much close to his heart, while hoping the resolutions from the meeting will promote women's empowerment. Liberia is the only country in the sub-region to have had a female president.
As Liberian feminist in chief, I am deeply dedicated and committed to the ideals of the empowerment of women in all aspects of our society, but particularly in leadership. I pray that the resolutions you will adopt here during this joint committee sitting will go a long way to advance the cause of women's empowerment in our region.
Honorable Mohamed Sidi Tunis, Speaker of the ECOWAS Parliament, underscored the need for 30% safe seats to be given to women as a giant first step.
We must endeavor to carry them along in every aspect of our undertakings. We should see them as the ones who complement us, not compete with us. We must see them as our right-hand persons, not rivals. We must see them as collaborators and not contenders.
Despite the strides by some countries with the legislation of relevant laws, there is a need for more action to be taken to achieve the set target of empowering women in the sub-region. Reporting for QTV News, I am Alucise.
And now to some sad news. A fire killed at least 20 nursery school children in Niger's capital, Niamey, on Tuesday, as government officials say they got trapped in a straw hut classroom in a school in a poor neighborhood. William Kamara tells us more.
Reports say authorities in the Sahel country have built thousands of straw huts to serve as classrooms, with children sometimes seated on the floor, and fires in these buildings are fairly common, but such accidents have rarely proved fatal. Niger's head of fire service, Colonel Bako Abubakar, told the BBC, and I quote, "There were 20 deaths, most of them young children," adding that the cause of the fire was unknown. Also, an official from Niger's Teachers Union said the school in the popular Peba neighborhood had around 800 students, including children in the nursery section. Another fire service official said 21 straw hut classes caught fire, and it happened when they were in class. Niger's public television, citing witnesses, said the fire had broken out at around 1500 GMT when the victims were in class. Rescuers were not able to escape. According to statistics, Niger is ranked as the poorest country in the world under the UN's 189 Nation Human Development Index. Prime Minister Mohamedou also traveled to the scene of the tragedy to offer his condolences to the children's parents. For QTV News, Lolly M. Kamara.
Well, our prayers and thoughts are with their families. I'm afraid that's all about it, but do join us tomorrow for more news. Until then, on behalf of the entire production team, thanks for watching.